Hi, I'm Ashley Barclay, and this is my Healthcare Innovation Multimedia project about 3D printing prosthetics. The history of prosthetic 3D printing. Prosthetic 3D printing is the use of 3D printing to design and create artificial wearable body parts such as legs, hands, and arms. In history, the prosthetic 3D printing is marked by significant advancements in technology and innovations, leading to more accessible and customizable solutions for individuals in need of prosthetic devices. The concept of 3D printing was originally developed by Charles Hull in the 1980s. There were efforts to create 3D printed prosthetics from 1990 to 1999, but the first fully functional 3D printed prosthetic leg was created by Scott Summit and Dr. Kenneth Trainer in 2008. In 2012, Richard Van Az and Ivan Owen collaborated to create the RoboHand, a 3D printed prosthetic hand. This project highlighted the potential for affordable and customizable prosthetics with the help of 3D printing. Before 3D prosthetic printing, the practice of creating prosthetics involved traditional manufacturing techniques, which were time consuming, costly, and less customizable. This process included casting and molding, custom fitting, manual shaping and sculpting, assembling, adjustments, alignments, and cosmetic customizations. Prosthetics were originally made with materials like wood, leather, metal, and later they transitioned to thermoplastics and polymers. Fiberglass and carbon fiber composites were also introduced to create lighter, more durable prosthetic limbs. The original process of creating prosthetics before 3D printing could take several weeks or months due to the initial long process of casting and multiple fittings to ensure comfort and proper function. The intense labor and cost of materials made prosthetics expensive and out of reach for many people who needed them. The growing demand for personalized, affordable, and quickly produced prosthetics makes 3D printing an attractive solution across various consumer groups. These groups include amputees, veterans, healthcare providers, educational institutions, adaptive athletes, low income populations, nonprofit organizations, and developing countries. Nearly 2 million people in the US are living with limb loss, and about 200,000 amputations occur every year. Despite these high numbers, only about half of these people receive prosthetics. With the help of 3D printing, these numbers could significantly decrease. How has 3D printing improved the production of prosthetics? Firstly, there has been a significant reduction of time required to precisely personalize, fit, and produce prosthetics with the help of detailed digital scans. This faster production is essential for growing children who need frequent adjustments. Reducing production costs has made prosthetics more affordable and accessible for low income and developing regions. Nonprofits and community groups can provide free or low cost prosthetics for those who need them. Innovative materials like sensors, electronics, and other technologies offer better performance, comfort, functionality, and reduce the risk of sores and discomfort. These benefits impact the overall quality of life and patient satisfaction for those in need and have a profound impact on healthcare. Challenges organizations face with 3D printing prosthetics. 3D printers, equipment, and advanced materials that are suitable for prosthetics can be expensive and require a substantial initial investment. Designing and producing 3D printed prosthetics requires specialized knowledge. Organizations will need to invest in training staff and hiring experts with the necessary skills. Prosthetics must meet regulatory standards and be approved by health authorities. The quality, safety, and effectiveness of products must be proven and cleared by the FDA. Companies that previously purchased parts from other manufacturers could print parts themselves with 3D printers, creating issues with patents, trademarks, and copyright infringements. Challenges patients and clients may face. 3D printing can reduce the long term cost, but the initial cost could still be significantly high for some people. The materials available for 3D printing is more limited compared to traditional manufacturing, which could impact the quality of the prosthetics. Many coverage programs only cover one prosthetic per lifetime, and some only allow one every 5 years. Some insurance programs have type based exclusions, which prevent access to more advanced technologies. Although 3D printing has its challenges, this technology not only enhances the quality of care for patients requiring prosthetics, but also contributes to more efficient, sustainable, and equitable healthcare delivery.